Amen. All right. Well, I really appreciate the opportunity to be with you guys today. I am going to, let's see, change a couple of things on here. I'm going to spotlight myself. I think if I can spotlight. Okay. And then now I'm going to share my screen because I've got some slides that I would like to show you. And there are a few videos in this that if you're squeamish and you don't like creepy, icky stuff, then I'll let you know before I start the little video. I think I have 2 videos embedded in this because it's pretty graphic. So let's go ahead and get started. You know, parasites in humans are a lot more common than you think. And a lot of times whenever I talk to people about this, they look at me as though I have 3 heads because, you know, parasites are not an issue for us here in America because we're clean. But that is not the case. And it's unfortunate that people think this way because many people, to quote Dr. Lee Merritt, parasites will not only make you sick, but they'll keep you sick. If you have some other chronic illness, anyone who has any kind of chronic illness, be it cancer, autoimmunity, or whatever, parasites is an issue that has to be addressed. But before we really get too far into this, I want to share this disclaimer that I encourage you to do your own research because I'm trying to find this thing to move. Okay, move these things. At any rate, you need to do your own research because you may have things that I don't know about. You know, I have so many people that contact me. We have a web store and I sell like the Parasite Detox Kit and different things on our web store. And people contact me and say, well, this interferes with such and such a medication. Well, there's thousands of medications out there and I can't be held responsible for understanding the interactions of the herbs that I sell with all the thousands and thousands of medications that are out there. So I encourage people to do their own research and just lay that disclaimer out there that, you know, you need to research these things for yourselves because there's only so much that I can know. I'm not infinite. So how do we get these parasites? You know, people think that, again, that we're too clean for that, but you think about it. How do dogs and cats and all clean themselves? They clean themselves with their tongue by licking, and they lick parts of their bodies that we don't want to touch. But then after they lick that part of their body, you know, their backside where these parasites come out, then they lick their fur to clean themselves, and then we pet that fur. So it is a guarantee that if you have any pets, you have parasites, and you need to you know, consider doing a parasite detox. If you garden, there are parasite eggs in the soil. And so if you have your hands in the soil and you're stirring up that soil so that the eggs are microscopic, you can actually even inhale those things. And so that's another thing to consider. Meat eating, meat eating, and even it's not just meat, it's even dairy products have these microscopic parasite eggs in them. And even if you shop at the grocery store, let me give you this statistic, 70% of shopping cart handles are contaminated with E. coli bacteria. So that lets you know what people are not doing after they use the restroom. And so there's a lot of parasite eggs on, we call them fomites, or things that we touch, you know, inanimate objects, doorknobs, shopping cart handles, door handles. All these things are avenues that we can come in contact with these parasite eggs, and also the fruits and vegetables that are sold in supermarkets. You know, you don't know the habits of the person who's handled those things before. You pick them up in the grocery store to inspect them. And one of the most notoriously contaminated is avocados. If you pick up you look at all the grooves and everything in an avocado, you pick that up and look at it, you're basically handling parasite eggs. Now, I don't want you to be creeped out by this. Just practice good sanitation and do a parasite detox. But these things are very real. So basically, just living in the environment that we live in, we're going to be exposed to these things. So it's something that we all need to consider looking at. Here are a few signs and symptoms of parasites, and you can see on the picture there that you can even have a parasite in the eyeball. They can get into all your organs, even the brain. Parasite. There's been people who've had MRIs on their brain, and they thought it was a tumor, and they go in there to do surgery, and here it's a sack of parasites. So this is real. So some signs and symptoms are tooth grinding. That's a big one. Anytime somebody comes to me with tooth grinding, restless leg, this kind of things, I look at two things. One is parasites, and the other is magnesium deficiency. Thrush or coated tongue. Anytime somebody has a yeast infection, you really want to look at parasites, and we'll talk about that more a little bit later. Itchy anus, restless legs or leg cramps, bloating, gas, food cravings, autoimmune disease. And I didn't learn this until, I don't know, maybe a year and a half or two ago, that parasites can actually trigger autoimmunity because they cause massive inflammation in the body. Liver problems, skin problems, and I'll share, and maybe I'll just share a little bit about it now. If you don't know about my health journey, I have some videos on it, but I had 2018, I had tetanus, August 2018. And then January of 2019, I got Rocky Mountain spotted fever from a tick bite. I had been exposed to mold prior to either of those, but I didn't understand mold toxicity then. And then we sold our farm and moved into another farmhouse that was severely infested with toxic mold. And that almost killed me. And then that developed autoimmune disease and just all this, I ended up having 5 hand surgeries because the type of autoimmune disease I have affects the connective tissues. And I had trigger finger. My fingers would just lock. So if you want to learn more about mold toxicity, we have a Zoom meeting coming up on that this Friday. So you're welcome to join. It will be live streamed to our YouTube channel, which is under my name, Danna Gesellchen. And maybe at the end of this presentation, I can share a link. Virginia, you can share a link for our YouTube channel. But at any rate, when all this happened to me, one day I got really sick and my liver swole so much. It was swollen. I had acute hepatitis. You could see it out from under my rib cage. And I thought, Lord, what is wrong with me? I knew if I went to the doctors, they wouldn't know what to do for me, or they would give me all kind of drugs and stuff. I was severely nauseated, throwing up, just sick as could be. And so I was pleading with God to tell me what I needed to do, what was wrong with me. And parasites kept coming to my head. Well, I kind of brushed that off because I had done a parasite detox already, and I passed a lot of stuff. But I thought that it can't be that because I've already done that. I've already dealt with that. Well, I didn't really understand parasites as well then as I do now. So the more I prayed, the more that came to my mind. And so I said, okay, I'm going to take this as your voice. And I really hit the parasite detox hard. And I did it right this time, the first time. And I'll explain what I mean by did it right a little bit further in the video. But after about 2 days, I passed this big wad, excuse me, but we're all grown-ups here. I'm just going to tell you like it was. I passed a big wad of mucus that was just packed with parasites. And every day I would pass a few more parasites, and every day I felt incrementally better. And after about 3 weeks, the liver swelling was completely gone. Well, why was that? Why was that happening? And it's because parasites, and I'll show you a picture a little bit further on in the presentation, they like to hang out in the bile ducts in the liver, where all the liver and the gallbladder and the small bowel and all that hook up. Parasites like to hang out there. And I believe that what was happening was the parasites were plugging my bile ducts, and my liver couldn't drain toxins. So I was getting very sick. And so, and I'll show you more pictures about this later. So you can see the other symptoms that can go along with this. And so I want to show you some lab work that might you might see if you have parasites. Now, I don't necessarily go by lab work. I just know that, let me show you quick the test for parasites that Dr. Todd Watts developed. Very sophisticated, and you can all do it right now. If you take two fingers, the base of your wrist here on the thumb side, just take two fingers and put right there. You can do this. If you feel a pulse, you have parasites. So very sophisticated test. Basically, if you're alive, you have parasites and you need to do a parasite detox. So, okay, you might see increased eosinophils. You might have IgE antibodies in a blood test if you have intestinal parasites. You might see a decrease in ferritin and hemoglobin. Parasites can definitely contribute to the development of anemia. And sometimes, as I mentioned earlier, you can see cysts and what looks like tumors on a CT scan and organs that are actually parasites. And I have a series of videos on our YouTube channel on the liver and how to do a liver flush and a liver detox. And I mention in there that I've done research on this quite a bit. And I have found in several places that when you have gallstones or liver stones that you pass during the liver flush, that each one of those stones is actually an encapsulated parasite where the body tries to round that thing up. And so that's, I've done liver flushes and I've passed a lot of stones. And so that's a lot of parasites. Blood in the stool can also be a sign of parasites. According to one study, and I've just mentioned this, parasites have, no, this is not what I mentioned. I was thinking this was a slide on the cysts. According to one study, parasites have the capacity to redirect attacks of your immune system away from themselves. And this is how it develops autoimmunity, because when it directs attacks of the immune system away from itself, then your body knows something's wrong. The fire signals are going off, and so it ends up attacking other tissues in your body, and that's how you can end up developing autoimmune disease. What are the types of parasites? Now, this is a broad category here, just to kind of introduce the topic. We basically have protozoa. These are the microscopic critters. We'll talk about some of those in a minute, like Giardia, from drinking contaminated water and things like that. Malaria is one. Mosquito bites and cryptosporidium. And then there's the helminths. These are the ones that we typically think about seeing in our stool. The roundworms, pinworms, flatworms, tapeworms, these kind of things. And then there's ectoparasites like ticks, and I'm sure y'all are in the South, you know what chiggers are. And then there's bed bugs too, which are completely disgusting. If you do a parasite detox and you're passing and seeing parasites in your stool, which, let me mention something here, and that is that if you have, typically the test that doctors want to run to see if you have parasites is O&P, ovum and parasites, and those are just notoriously inaccurate. They're almost always negative when people are infested with parasites. So, but if you do a parasite detox and you're seeing a lot of parasites in your stool, you're only seeing 30% of what's there. And I'll prove that to you in just a minute when we watch one of the little video clips. And I want to show you, this next slide is a video clip of an actual tapeworm inside of a human.
Called Tinea saginata.
Can you hear that?
Tinnias are intestinal tapeworms that are only definitively hosted by humans. Indeed, in the present case, T. saginata are seen throughout the distal duodenum to the proximal ileum. This is a whole clue of tapeworms. The length of an adult worm is usually less than 5 meters. However, it may reach up to 25 meters, like in this case. An estimated 80 million people are colonized with beef or pork tapeworm. Humans become infected by ingesting raw or undercooked infected meat, containing sister cerci. Most people colonized with adult T. saginata are asymptomatic. Those with symptoms complain of mild abdominal discomfort, loss of appetite, or change in stool pattern.
Okay, that's enough of that. Here are some pictures of actual, you can see the tapeworm down there in the lower left. Roundworm, hookworm. The hookworm looks like some kind of monster. Nematodes, and then the flukes up here in the upper right corner, these typically reside in the liver, and they can really cause major issues in the liver. Here's a close-up of the mouth part. I mean, this is really, you can see the hooks on there. Basically what he does is when he opens his mouth, this part right here on the end will open, and these hooks kind of stand up, and then they whenever they close, those hooks dig into your intestine, and so these things can actually embed in the intestinal wall, and you can't see them on a colonoscopy because they've hidden themselves. Okay, here is an actual colon that was removed from a 3-year-old. This child was impacted and had a bowel obstruction because he had so many parasites. If his parents had known and had done a parasite detox, this child might have been able to keep his colon. But if he survived, I don't even know if he survived this, he probably has a colostomy and will for the rest of his life. So this is no play toy. All right, I think the next one is another video that I want to show you that kind of illustrates this in living color.
So here before us, Askari Zumbrikoidu.
Wow.
The largest station Dr. Nyashira has ever seen.
In Southern Sahara.
She will never eat spaghetti ever again.
My. Spaghetti. Wow.
But Dr. Nyashira is about to vomit.
Wow.
Dr. Maina, you really missed out.
What is this? My.
Okay, I think that's enough to get the point. This person had a bowel obstruction and had to have surgery to have all those parasites removed, you know, and it's real. And this is a lot more common than people think. Okay, here's one of the parasitic ones, the microscopic ones, toxoplasmosis. This results from the infection of the Toxoplasma gondii parasite, and this is usually from eating undercooked or contaminated meat or exposure to infected cat feces. And this can be very serious for pregnant ladies. So pregnant ladies should never change the litter box when she's pregnant. Okay, according to Dr. Dan Kalish, the picture here on the right, it looks like some kind of little goonie monster, but this is Giardia. And according to Dr. Dan Kalish, I was listening to a lecture by him one time, and he said this, and it just blew me away. Giardia cysts can live under the fingernails for 6 months. So good hand washing, get the scrub brush up under the fingernails and stuff, especially if you've been camping or something. So parasites, you know, you can either be symptomatic or not symptomatic. They can be actually debilitating, or you can just feel fine. It's just amazing to me. And the symptoms can be cyclical, which is important because this can mimic hormonal issues for ladies that are estrogen dominant. And I may have a slide on this later, I don't remember. But estrogen, if you have too much estrogen, can cause spasming in the bile ducts. So estrogen dominance can contribute to this parasite issue, because if you have parasites there and maybe there's enough of an opening for the bile to flow, and yet you have this estrogen dominance, you're going to have that spasm there. So the estrogen, of course, fluctuates with the body cycle, and so the issues can be cyclical. Okay, I mentioned that the stool test can be inaccurate, and we did Dr. Todd Watt's parasite detox test. The most accurate test, if you want to test, is the GI map test, and I've had this done, and it's a very, very interesting test, very detailed, in-depth test. If you're going to do a parasite detox, it's very important to ensure that you're having 2 or 3 bowel movements a day. The definition of constipation is having 1 or less bowel movements per day. So if you're only having 1 bowel movement a day, you actually are considered constipated. If you read Dr. Kellogg's book, he has what's the name of that book? Colon Hygiene. That's a very eye-opening book. Some people can be slightly constipated, excuse me, by the actual parasite detox itself. And I'm going to show you in just a few minutes what we use for a parasite detox. It's extremely effective, but it can be mildly constipated to some people. So you want to do something to help move things along there. And we do include that in our parasite detox kit. Now, when you do the parasite detox, you think about it, these worms are in there, they're putting their waste inside of you, they're eating your food. And so you may be malnourished and toxic because of them, because of their waste, and because of them taking the nutrition away from you. So as you do something to kill them, their bodies are decaying, for one thing. That's why you only see 30% of them in the stool whenever you pass, because immediately when they die, their bodies begin to disintegrate. As they're dying, they pass a lot of eggs because, they want to live. They want to pass on their DNA just like, all other creatures. Now, they pass eggs inside of us anyway, but all those eggs don't necessarily hatch. But as they're dying, the adult parasites, as they're dying, they put out this chemical signal that causes all those eggs to hatch. Plus, they pass all these extra eggs to try to survive. And this is when I mentioned earlier that I didn't do the parasite detox correctly. I didn't take something to kill those eggs. I just took to kill the adult parasites. And so we'll talk about that more in just a little bit. But as they die, you really need to take, as you can see in that 3rd bullet point, activated charcoal, bentonite clay, French green clay, something to act as a binder for the toxins that these parasites put off as they die, because die-off symptoms are no fun. Muscle aches and pains, brain fog, anxiety, headache, all these things that you think about when you have the flu. These are symptoms of parasitic die-off. Just a few points. If you have gut dysbiosis, any kind of upset in your GI tract, you really need to treat parasites first, except H. pylori. According to Dr. Dan Kalish, you really need to treat H. pylori first. And I don't fully understand that, and I'm looking for some research on that. So I'll update this talk whenever I find that out. There's a strong connection between yeast infections, heavy metal toxicity, and parasites. And we'll talk a little bit about that a little bit later. The gut needs to be functioning better before you address these heavy metals. So you really need to do the parasite detox first. If you know somebody that's been dealing with candida and they just can't seem to kick it, have them do a parasite detox, because that's foundational to getting rid of candida. Anytime you have an immune system that's compromised or stressed, as in autoimmunity, cancer, anything like that, even the virus that had been going around for a while, you really need to look at parasites as an issue. I mentioned this earlier. They burrow into the lining of the gastrointestinal tract, and this makes them very difficult to reach. They are masters of disguise, and they are very, very resistant to treatment. So you have to be consistent. Parasites can harbor Lyme, mold. So anybody that has mold toxicity really needs to look at the parasite detox, viruses, and more. If parasites are not treated, progress at treating these tick-borne diseases is not going to be as successful as it might otherwise be. Okay, here's the slide that I mentioned just a minute ago. Parasites weaken the immune system. Parasites absorb heavy metals into their bodies, and Candida yeast feeds on heavy metals. So here you have the stack: parasites, heavy metals, Candida. So that's why you have to go to the base and get rid of the parasites. And that's also why you may have die-off symptoms and need to take the binders to help to alleviate the die-off symptoms and stay well hydrated as well. According to this man, you may recognize this man, Dr. Brian Ardis. He's pretty popular these days when it comes to the virus issue that's been around. His sister, I believe it was very sick. And I can't remember if she actually had lupus or she had pancreatitis or something. But anyway, he found out that lupus is caused by a parasitic infestation in the spleen. And so you remember I mentioned earlier that lupus is an autoimmune disease, that autoimmune disease can be triggered by parasites. An enlarged spleen, pancreas, or liver can be caused by parasites. And I learned that by personal experience. This is a roundworm plugging someone's bile duct. This is an actual video on YouTube. I didn't want to share it because I just felt like I had too many videos embedded. But they actually, in this video, you can go to that address there and find the video. But when they pull that roundworm out of that bile duct, the bile just started flowing and coming out of that bile duct. So they can actually plug it up. Let's look at some dietary issues. If you want to grow parasites in your intestine, this is what you eat right here. You know, the fruit juices, sodas, and sugary drinks, a refined carbohydrate diet, lots of bread, lots of pasta, lots of white potatoes. These grow good parasites. Jams, sauces, ketchups, all these are, have lots of sugar. Dried fruits, granola bars are loaded with sugar. Commercial cereals loaded with sugar. Look at the grams of sugar in the ingredient list. Pork is the parasite factory. That's a given. Raw or undercooked fish and other meats. Here's the good guys. If you want to discourage parasites, these are the things you can do. Garlic and onions, pumpkin seeds, greens and leafy green vegetables. Anything bitter, like arugula or even lemon kind of is considered a bitter. Peppermint tea, radishes, all these things help to increase bile flow, and that helps to keep those bile ducts open and clear of parasites. Ginger and turmeric, and then there's herbs. These herbs are in our anti-parasite blend, and this is what actually takes care of this blend. In the last bullet point is what actually helps to take care of the eggs. This is what we use. These are the components of our parasite detox protocol. Our protocol is if you go to our webpage at closureforjesus.com and go to the blog tab, there is a blog write-up on how to do the parasite detox. It's free. Just go there and look at that. And then we have a kit, a parasite detox kit on our web store at Closure for Jesus. Just click the store tab. The Mimosa pudica, I have never seen anything work on parasites like Mimosa pudica. I've used ivermectin. I have used all kinds of just different herbal combinations. But when I added Mimosa pudica seed is when I really started seeing parasites. And the nickname, one of the nicknames of Mimosa pudica seed is gut scrubber, because it helps to, a lot of us have stuff in our intestines that we've been packing around for 10 or 15 years. And the mimosa helps to scrub that off the surface of the small bowel and the large bowel. The way that Mimosa pudica seed works on the adult parasites primarily is by suffocation. And we all got to breathe. Nobody gets immune to being suffocated. But it also has a mild stunning effect. So it helps to prevent the worms that are in the GI tract from burrowing and hiding, because it kind of stuns them a little bit and slows them down, and then it suffocates them. And again, as they are being suffocated, they pass all these eggs, they pass this chemical signal for all those eggs to hatch. That's how I reinfested myself, because the first time I did this parasite detox, I only took mimosa pudica seed, and I didn't take the anti-parasite blend to kill the eggs. And so I made it worse. Okay, so you have to address the eggs. And that's what the wormwood and all this blend here does. Don't take just the mimosa pudica seed. You have to take both. And then an interesting point at the last bullet point there, some people actually add cloves when they're cooking pork, because that helps to kill the parasites. So we need to support our liver during a parasite detox, because there's so many toxins that are released when you do this detox. And so these are things we've touched on some of this, but I'm going to specifically talk about it now. Increase the bile flow. Drinking the warm lemon water first thing in the morning is very good to increase bile flow. Eating the bitters, drinking peppermint tea. All these things are things that you can do to support the liver. Milk thistle is a good one. Dandelion is a good one. Of course, wormwood, gentian. These are all the bitter tasting herbs, very good for the liver. Bitter is better. Okay, bitter is better for us. It's better for the liver. So those are some things that we can do to support our liver. Before you do a parasite detox, you really need to make sure your drainage pathways are open. Make sure that you're having 2 bowel movements a day. Sweat. Now, we include something in our parasite detox kit for helping to open the pathways, and it's very effective and very safe. Make sure that you're sweating. That's an avenue of elimination. Drinking plenty of water. Make sure your kidneys are supported. Breathing deeply. That, making sure that you don't have any tight bands around the waist, that your lungs can expand. Opening the bile flow, which we've mentioned. Keeping the lymph moving. Walking is good. Rebounding is good. Dry brushing is good. All these things are going to support our avenues of elimination. A person with good health can take up to 90 days to eliminate parasites. And again, I don't know that we're ever going to fully eliminate them, but we can deal with infestation. And personally, I believe that we all need to do at least, at the very minimum, an annual parasite detox. I prefer to do it quarterly. But now, if you have someone who has a chronic illness, it's going to take a while to get rid of the parasites, because they get such an incredible foothold in the body. Parasites are more active during full moon. This is, from what I found in my research, there's basically 2 reasons. One is because their bodies are largely water, and they respond to the gravitational pull of the moon at full moon. And so they're more active at that time. And that's also when they mate. So they come out of hiding, as it were, during full moon. And so that's when you can really whack them, a little bit better. They're a little bit more vulnerable during that time. So if you see results, like, I mentioned earlier, if you see 2 parasites in your stool, that's only 30% of them. So 70% of them you're not seeing. There's many, many more inside that you're not seeing. There's a couple of ways that we do the parasite detox. There's what we call the full moon challenge. That's either a 3, 5, or 7 day parasite detox monthly. Now, this is all explained, I'm throwing a lot of information at you, but all of this is explained in our parasite detox protocol on our webpage. And when I finish the talk, which I'm almost done, I'll share the link with you for that. But just kind of throw this out there. The full moon challenge is actually more intense than doing it every day for 90 days. So you basically just do it 3, 5, or 7 days. Now we're straddling full moon with those days. So like, if you're going to do the 3 day, it would be the day before, the day of, and the day after full moon. If you're going to do 5-day, it would be 2 days before the day of full moon and 2 days after full moon and so forth. So the milder one is the 3-day. And if you're going to do the 7 days, that's a little bit more aggressive. And this is more aggressive. So if you have someone who is really sick, it might be better to start with the milder, just do it for the 90 days. And then after that, after the 90 days, if somebody has a chronic illness, then you can pick up with doing the full moon challenge every month. With my health issues that I've had with the Rocky Mountain spotted fever, the mold toxicity, and all these things, I do the full moon challenge every month. So, and that is safe to do. Okay, this is our webpage, closureforjesus.com. And then you'll just see the tabs at the top. You can go to the blog tab and scroll down a little bit, and you'll see the parasite protocol. You can read that. We have different videos on our YouTube channel about how to do this. And then you can, we've recorded this so we can go back and watch this again. So I'm going to stop screen sharing.